Hello, I'm Fern. This video provides information on gastro-esophageal reflux, which is also known as acid reflux, and its drug treatment. In our digestive system, there are esophagus, stomach, and the esophageal sphincter muscle, which connects between our esophagus and stomach. Acid reflux happens when your stomach contents come back up into your esophagus, giving the burning sensation around your chest. Acid reflux is the most common disorder of gastrointestinal tract. It occurs when the esophageal sphincter muscle relaxes uncontrollably, giving chance for the gastric contents to move upwards. Temporary relaxation of esophageal sphincter muscle after eating is normal. Usually, if the contents move up to the esophagus, the muscles along the esophagus will help to move the content back down to the stomach, and the saliva we swallowed will wash away the gastric acid remain on the wall of esophagus. However, in the case of acid reflux, the relaxation of the esophageal sphincter muscle is prolonged, long enough for the contents to flow back upward to the esophagus. Overfilled stomach and food that are high in fat will increase the period of the muscle relaxation. Acid reflux is caused and sometimes made worse by certain food and drinks, overweight, smoking, pregnancy, stress and anxiety, some medicines like anti-inflammatory painkillers, hiatus hernia, which is a medical condition where part of the stomach has moved up to the chest. The main symptoms you might experience when you have acid reflux are as follows: burning sensation in the middle of your chest, unpleasant sour taste in your mouth, which is caused by the acid from the stomach, coughs or hiccups that keep coming back, hoarse voice, bad breath, bloating, and feeling sick. There is a number of medicines available in the pharmacies, mini-marts, supermarkets, and department stores which can help you to treat and relieve symptoms caused by acid reflux. Effective medicines for acid reflux includes Gaviscon oral suspension, Melox Plus suspension, and HOE's milk of magnesia. Antacid taken will chemically react with the acidic contents of the stomach and create a protection over the lining surface of digestive tract. It also reacts with the stomach acid and gives out carbon dioxide bubbles. The bubbles float up to the top of the stomach contents like a raft. When the esophageal muscles are contracting and relaxing, the raft will act as a barrier to prevent the stomach contents to move up into the esophagus. How much do you need to take? For children who are 12 years old and older, as well as adults like Mr. Ahmad, they are required to take 5 to 10 ml, which is equivalent to 1 or 2 teaspoons of the antacid suspension. Make sure you shake the bottle before use. Take it after each meal and at bedtime before sleeping. If you are taking HOE's milk of magnesia, take it only at bedtime before you sleep. After using the product, make sure the cap is well closed and place it in a cool, dry place away from direct sunlight. Keep it out of reach from children. This product has a high sodium level. Be careful when this product is given to people who are on a low salt diet, especially people who has heart or kidney problems. Antacids may have reactions with some medicine as listed in the screen. The reaction can be prevented by taking the antacid in a correct way, which you may need to consult with a doctor before taking them together. There are several things you can do or avoid to relieve and prevent acid reflux. Eating small meals frequently is better than one large meal at one time. Lesser food in stomach, lesser chance that your stomach get expanded, and thus lesser chance of getting acid reflux. Do not eat within 3 or 4 hours before bed. Avoid bending, stooping, and slumping in armchair. Avoid wearing tight clothing, waistbands, and belts. Avoid smoking. If the symptoms do not improve after 7 days, please do seek medical attention in the nearest clinic or hospital as soon as possible. Now, let's check if you know how to take oral antacid suspension correctly. You are only required to answer it as true or false to the following statements. Number 1. 5 to 10 milliliters of oral antacid suspension should be taken by children who are 12 years old and older and adults who have acid reflux. True. 5 to 10 milliliters or 1 to 2 teaspoons of oral antacid suspension are required to be given. Number 2. When you have acid reflux, take oral antacid suspension before eating your meal. False. Oral antacid suspension should be taken right after your meal and at bedtime before sleeping. If your choice of antacid suspension is HOE's milk of magnesia, you are only required to take it before you sleep. Number 3. Oral antacid suspensions should be stored in the refrigerator after use. False. The product should be stored in a cool, dry place at temperature below 30 degrees Celsius. Keep it away from strong sunlight and young children. Antacid suspension is a good choice to relieve the burning sensation you experience when you are having acid reflux. Again, if you do not feel any better after 7 days, it is advisable for you to seek help from a doctor immediately. I hope you enjoyed this video. Thank you and have a nice day.